خلقني فهو يهدين والذي هو يطعمني ويسقين وإذا مرضت فهو يشفين والذي يميتني ثم يحيين والذي أطمع أن يغفر لي خطيئاتي يوم الدين. I recited few verses from today Shora 26, and the translation, according to Dr. Tatusmani, who created me and who guides me and who feeds me and gives me drink, and when I become sick, he heals me, and who will make me die, then will give me life, and who I hope will forgive my faults on the day of retribution. This is a very relevant surah in our Quran regarding the health, for which we are talking about today. Generally, I think you all agree with me that our health is the most precious and important thing which we own, no matter how rich or poor we are. But all the wealth in the world has worth not even a cent if we are not healthy and happy. So nothing can replace our wellness and health, because that allows us to enjoy our life. Very often we believe that wellness and health are the same thing. This is not really the truth. Health is a state of physical, mental, and social well-being. It involves more than just the absence of disease. A truly healthy person not only feels good physically, but also has the realistic outlook towards society, towards the people. And good health enables us to enjoy our life and to have the opportunity to achieve our goals, and that's really the wellness. There are many dimensions of wellness for living healthy and good quality of life. Emotional wellness, which we feel almost every day when we're interacting with our people in this world. Intellectual wellness, those 50 dishes, for example, are the intellectual wellness if we are able to contribute and understand those things. Social wellness, that's what we're focusing more and more nowadays, especially in our age, which we call a golden age, try to be more socially active, involved. Spiritual wellness, roza, namaz, zakat, all those things are, and physical wellness. So wellness is something which comes after good health. Good health will make us normal. Wellness will make us better than we are, both physically and mentally. And the knowledge is not only the power, but can also lead us to live both better and healthier life. And this is any knowledge that can impact our health and wellness is worth learning. And that's what we have this sort of gathering together, meeting our requirement of social wellness and intellectual wellness. In the past, we have a couple of gatherings of these of a few people based on history or architect, Spain, Bahisa. We had a literary gathering on Allama Iqbal. We have a political gathering on fall of Dhaka, and this is a gathering related to our health. When I thought about that, I've been talking to Oakville Hospital and a couple of people related to the diabetes things. And I went on a course for 3 days, and I found it to be very interesting for me. It was also very interesting for all of us, because at this age, we all are directly or indirectly, some or the other, involved and face the issue of diabetes. It's pretty common in our family. So I was very lucky to get hold of Lucy Florio. Lucy, she is a community health promotion coordinator with Diabetes Canada, and she has been working almost 24 years, and she's really enjoying in going out, meeting people in the community and informing people about these things and how to keep them healthy. We are very privileged to have a lady expert like Lucy over here to enlighten us about this major issue we have. She will be giving a presentation and talk, and we'll have most probably a lot of thought-provoking ideas. And what I learned, there are so many myths about diabetes which are not true. and I'm sure she'll be addressing that. I mean, so she will be speaking about also, and after that, I'd like to do a very interactive session. You can ask the questions, and she will answer it, and maybe some other people can also answer these questions. We have some professional doctors, we have some professional patients also. So both sides you can hear what's going on. So I'd like to request Lucy, please come up and give it the talk. Thank you very much.
Thank you. Hi, everybody. So I don't stand in your way. I'm going to try to stand up here. So I'm Lucy Florio. I'm a community health promotion coordinator with Diabetes Canada. We used to be called the Canadian Diabetes Association since 1953. And then on February 13th of this year, we rebranded to be Diabetes Canada. We just thought we needed a bit of a fresher outlook. Our goals and our vision is all still the same, and I'm going to talk about that today, but just our names changed. All the literature that I've brought, you're welcome to pick up. It still has some of our old branding on it, but the information is still accurate and all that. We just haven't gotten around to changing everything just yet. So here we are, Diabetes Canada, as we are known now. Our vision is a world free of the effects of diabetes. As was mentioned earlier, maybe some of you in the room have diabetes. I'm sure everybody in the room knows somebody that has diabetes. Is to find a cure. But while we're looking at that, working on finding a cure, we also want to prevent the onset and consequences of some of the awful complications that can come from diabetes. And we also want to help the people that are affected by diabetes live healthy lives while we work to find a cure. So it is a serious disease. In Canada, our population is about 35 million people, give or take. 11 million people out of that 35 million currently have diabetes or pre-diabetes. So that is 1 in 3. By the year 2027, 14 million people will have diabetes or pre-diabetes. That means that 1 Canadian is diagnosed every 3 minutes. So once I'm finished with the presentation today, 15 to 20 people will be diagnosed with diabetes or pre-diabetes, just in the course of the time that I'm here with you this afternoon. 1.5 million Canadians have type 2 diabetes and don't even know it. So that is one of the reasons why I go out into communities and do these presentations, to raise awareness about diabetes, the signs and symptoms, the risk factors, because there might be somebody that is listening to me today that might think, maybe I should get in to see my doctor. I haven't been feeling that well. And they could have diabetes and not know that they have it. So how does Diabetes Canada help? Anytime that you get a phone call from us asking you to donate some old clothes, clothing you don't wear anymore, small household appliances, that's our clothesline division. That money that is raised from us collecting those clothes goes to funding research to prevent, manage, and or cure diabetes. We also support healthcare professionals, I heard that there's some in the room, through our clinical practice guidelines, which come out once every 5 years, and they are the foremost book on diabetes and how to treat it in Canada. We also advocate with the government regarding costs of diabetes supplies. If any of you have diabetes, you may be able to acknowledge that it's quite expensive to buy your test strips, to lance your finger, all those little supplies that are needed. We also provide information about diabetes through community groups, me coming out to see groups like yourself, through our webinars. On our website, you can actually sign up for a webinar and it comes right into your house, into your computer. You can sit by your computer and watch at your leisure. And our webinars include things like foot care, reading labels, a whole bunch of different things. We also have a camp for children with type 1 diabetes, and that's called DCamp. And we're always trying to deliver accessible services through our 1-800-BANTEAM line. So our purpose today will be to achieve the following. First, understand what the
The room was corrected. She was not sleeping. The good thing is good weather. And you heard from a very experienced instructor, and also from a very experienced role model, Khan Sahab. MashaAllah, with 80 years of age, with around 2,000 push-ups a day, and all those eating your 6 shakes a day. But the result is, 6 shakes I think, but the result is, he's not diabetic, his wife is not diabetic. So that's also one of the cause of diabetes. His husband does so much of precaution. And
MashaAllah,
when he,
MashaAllah इनकी मैट्रिक्स चाहिए.
and MashaAllah, I mean, he's the one who always comes smiling. And गुनगुनाते भी आते हैं अक्सर ये हमारे वहाँ. हमें पता है ये बात सुन के आती है अपनी बेगम से ही है बेटा हमारे से. तो वही साहब ने पूछा कि तुम क्या गुनगुना रहे हो? क्या लगे कितने शीरी हैं तेरे लब पे रखी गालियाँ खा के बेमजा ना हो. यही मसला वही साहब के बारे में है. And Lucy, thank you very much. I recommend we have collected some sort of a picture for you, but please take one family, right? That would be great help. And Lucy, as a token of appreciation from the participants for a great netting, I would like to present you a small gift from my granddaughter.
There you go.
Like you are. That's very nice.
And I
Thank you
think
very much.
you saw a lot of information available over there. And I mean, I was wondering, I had a 3-day course at the local hospital, and she just basically condensed everything in 1 hour. I'll be also going 2 more courses, one for the food thing and one is to one. And I recommend, I think all of us should go for that sort of training, just to get some more knowledge about it. Lucy, thank you very much, and thanks for the interesting questions.
What I do is essentially I do my exercises, I do my walking. And like Dr. Sagar said, and like it has been pointed out, it takes care of the weight on my body, and I'm able to walk without putting too much stress on my joints. Also, I just float on the water and try to do the exercises which are necessary for the knee. That much about swimming. I'm not an expert in that area. That's just easier. Now, what other things can we do if there are problems with muscle weakness, or if there are problems with tendon and ligaments in the muscles and joints in our body? So, when we want to try to improve and strengthen our muscles, or after major episodes of problems, we want to have some mobility, be able to walk. And again, there are 2 aspects in this. One is mobility, and one is strength. Now, as regards to mobility, there are many different exercises, like they will tell you. They can all of those exercises can be done sitting down or lying down. I won't go into those exercises in detail. Just believe me, they can be done. Then we come to strength training. How can you strengthen the muscles or ligaments in your body? Strength training, again, could involve 2 things. The number 1, weight.